Welcome to this lecture on contraception, where we will look and explore the various types of contraceptive methods, their physiological effects on the female reproductive system, and how these methods can be evaluated using sonographic imaging. Understanding how contraception works, not just pharmacologically or mechanically, but also how it influences the body and appears on ultrasound, is essential for both clinical practice and diagnostic accuracy. Whether you're a healthcare professional, student, or ultrasound practitioner, this session will give you a comprehensive insight into the intersection between reproductive health and medical imaging. But before we begin, please remember to like, share, subscribe to my channel, and follow me for more lectures like this. So the first contraception type we're going to look at is the oral pills. Physiological effect of the oral pills: it inhibits ovulation, it changes endometrial lining and the thickness of the cervical mucus. Sonographically, ovulation does not take place. Non-dominant follicles may be seen. Endometrium appears as a thin echogenic line. Then you have the intramuscular injection, also called the depot-medroxyprogesterone acetate. This is taken every 3 months. It inhibits ovulation and thickens the cervical mucus. Ovulation here also does not take place. Endometrium appears as thin echogenic line. There is the capsule that is placed under the skin called the levonorgestrel implant. This is a thin capsule. It's placed under the skin, which may last for 5 years. It also inhibits ovulation and thickens cervical mucus. Ovulation does not take place with this. Endometrium also appears as a thin echogenic line. And finally, the IUCD, intrauterine contraceptive device. This is placed in the endometrial cavity at the level of the fundus and superior corpus. Infection like PID, perforation, attachment to the basal layer, and pregnancy, of course, are all complications that can arise from using the IUCD. On ultrasound, you see a series of hyperechoic linear echoes in the center of the endometrial cavity, showing posterior acoustic shadow. Ovulation and formation of corpus luteum occurs because it does not hinder physiological function of this. So if you enjoyed this lecture, please like, share, subscribe to my channel, and follow me for more. Thank you.